Hi, good afternoon, everyone. I'm Dr. Manu Chaudary. I'm a pediatrician and pediatric infectious diseases specialist at Rainbow Children's Hospital, Marathali, Bangalore. We decided to do this session, especially for all the parents who are quite anxious about the second wave of COVID. So the way I have segregated this session is under 4 headings. So first I will be talking about just understanding what second wave is. Second will be how to manage COVID at home, if your child is stable, or some other illnesses that you can manage at home, and then when to seek medical help. Third will be diet and activity, which a lot of my patients' parents ask me. And then fourth, we'll be talking a little bit about how the pandemic is gonna, how this is gonna pan out in near future. When are the schools gonna start? What about the vaccine in children? So all that. So I will be talking about these, and then once I finish talking, I'll start taking the questions. So feel free to post your questions, and I'll answer them at the end of my discussion. So first, coming to why the second wave. So there are two possible reasoning for it. First was, I think there was laxity of COVID appropriate behavior, which everybody's talking about. So, people became lax. There were a lot of gatherings without masks, without social distancing. So that was definitely one reason. The second reason was the transmissibility of the virus increase. So everyone is talking about various variants of the virus. So it's very well known for a virus to mutate. We've seen that for flu. We're seeing it for this virus. We're talking about these double mutant in Mumbai, triple mutant in Bengal. What all it means is they are the survival of the fittest. So there is mutation happening, and the virus with better opportunity to grow and transmit is getting selected naturally. So with the new variants, the transmissibility is 50% higher than what we had seen in the past peak last year. So that's why we are seeing clusters of these infections within family members. Usually earlier the children were asymptomatic, whereas now they're becoming symptomatic. Not everybody was getting infected in a family last time, but we are seeing almost everyone getting impacted by infection if one family member is getting affected. Talking about the lethality of these variants, we are still getting to know so far. There are some reports, yes, it is higher mortality compared to the previous strain, but I think as the pandemic evolves, we'll know more about it. What does this second wave mean for children, right? So that's a big question. As we have seen so far of managing the children, we are definitely seeing more children coming to the hospital and more children getting affected. And one of the reason could be just because, the transmissibility is high. As regarding to symptoms, we are seeing little longer duration of symptoms, including fever in children. So the previous time we were seeing, 3-4 days of fever, children will be fine and they'll do well. But here we are seeing even 7 to 10 days of fever. So the fever is lasting little long. And then we are seeing some conjunctivitis as well in this in acute COVID this time. Rest of the symptoms are pretty similar. They are having some runny nose, cough, congestion. They might develop vomiting, loose stool. They might even develop high-grade fevers. So we are seeing high-grade fever this time. And in very few cases with high-grade fevers, they can have some seizure issues if they have propensity or family history of seizures with fevers. So those are the kind of symptoms we are seeing in this pandemic with the second wave. Can we differentiate it from other infections? So apart from COVID, we must know there are a lot of viral infections which can happen, right? So there are summer coronaviruses, there are para-influenza. So a lot of viruses that we see with weather change, with spring coming in. So your child can still get the other infections. They can still get dengue, very few cases, but we see it. They can still get typhoid, urine infection. So differentiating from other viral infections is little hard. but let your pediatrician do that for you, right? So if you have a child who develops fever at home, if you have strong history of somebody becoming positive, COVID positive, then we highly suggest that you get your child also tested if they develop symptom and seek medical help, right? And if your child is clinically stable, you can do that online. Most of the pediatricians are providing online consultations, and including the Rainbow Children's Hospital. So just reach out to your doctor on day 2 of the fever. Please discuss the case, and they will help you decide how to go further. Some of the warning signs which I educate all my patients' parents is, and these warning signs are when you have to come to the hospital. You don't have to wait. First is if the fevers are high grade and you're not able to control it with oral medications. Second, if they have high grade fevers and they have seizures, then you need to come to the emergency room. If they have high grade fevers, along with which if they're having a lot of vomiting and loose stool, so there is a identity called COVID related multisystem inflammatory disease, MISC. What happens is your child might have had acute COVID in the past and then develops antibodies, so protection against it, but your body might react adversely to these antibodies and they can develop these lot of fevers, red eyes, red lips, vomiting, loose stool, which can impact their heart as well. So in that, if your child is developing that kind of symptoms, definitely seek medical help because they need special care in the ICU and then special medicine. Most of these kids in the past wave did very well for us. Most of them were discharged home timely and none of them had much side effect to their heart. So, but definitely be aware of this identity. What can we do? So those were the warning signs where you have to seek medical help, physically showing your child to a doctor if not in working hours, in emergency room, if not in the OPD. Now coming to managing infections at home. So suppose your child is doing okay, was COVID positive, your doctor is quite certain that you can manage the child at home. So what are the things to do? So the first thing is isolation, right? So if it's kind of hard to segregate the primary caregiver, which is usually a mother, from the child, even if she's negative. So what I usually suggest parents is try to wear mask as much as you can, especially if you're a high risk host. Okay, if you have diabetes, hypertension, some other issues which can make you really sick. First, try to find another caregiver. If not possible, ensure you're wearing a mask all the time. Hand hygiene before and after handling the child. At night, I usually suggest if you can segregate yourself from 6 feet in a good ventilated room, that should be okay. Wearing mask during sleep is not recommended. So, but as long as you can maintain that distance in a well ventilated room, you should be okay. Of course, if you develop symptoms, then you need to get tested and go about your taking care of yourself. For children with COVID, again, most of them will be fine. They can be managed at home. The main management is fever management. So fever medicine, your doctor will tell you round the clock how you can use for how many days. Usually what I suggest is if the fever is lasting beyond 3rd, 4th day and it is high grade, it's not getting better, I call most of my patients and then do some set of blood investigation to make sure they're not going into other kind of issues or some other co-infection, because the child can get COVID with some other infection like urine infection or typhoid. So we make sure that we see our patient at day 4, 3 to 4 of fevers, or if they're not getting better. So fever management. Second is hydration. So ensure they are keeping hydrated. They might not enjoy their regular food, so ORS tetra packs or coconut water liquids, so that it's easy for them to swallow. Do not panic. they will catch up their appetite in couple of days. Just like adults, they can also have some sore throat as well as some change in the taste and smell. So those are the two important things. There's no indication to do antibiotics like azithro, augmentin, doxy, ivermectin, fabiflu in children. There's no indication. The only time we do medication is when they get admitted and they are oxygen dependent, and then we decide if we need to start that particular medicine which everybody is talking about, remdesivir or and steroids. So that will be a decision of your doctor and not you. Okay. And or if they are those spectrum where the whole body is reacting, MISC, in those cases we give another special medicine, get their heart evaluated. So that is all in the hospital, guys. You do not have to worry about it at home. The one frequent question I'm getting asked is when to get the child tested if the family members are positive. So there are two ways to go. Some parents are nervous, so they do it very first day, even when they are not symptomatic. Usually what is suggested is once they have been exposed, 5 to 7 days after that first exposure is when we say to get a person tested at home, because that's when most of them develop symptoms. So usually 5 to 7 days from the first exposure to a symptomatic person is when the testing is suggested, or at any point when they have become symptomatic. So go ahead with that. A lot of patients also ask me, how do we know the virus is gone? So there is no need of repeat testing, guys. We usually say first day, 10 days from first symptom, as long as the child is improving, not needing fever medicine last 24 hours, we do not need to retest, because a dead virus can also be picked up with the RT-PCR testing. So no repeat testing is required in children. The other question usually which is being asked is what is some of the first aid we should always keep handy at home, because with the lockdown happening. So definitely have fever medicines. I usually suggest Calpol, paracetamol, Dolo syrup. Instead, I usually do not like drops because they're very concentrated and sometimes we can have medical errors. Do not go for combination medicines. So I usually suggest ibugesic plain in case the fevers are very high, or anti-cough medicines. Usually below 6 years, anti-cough medicines are highly not recommended. So we usually say we do use some anti-allergic medicines for runny nose and dry cough. So Livocet, Allegra, these are some of the medicines. Always check with your pediatrician when you are dosing your child, because some of these anti-cough medicines have some components which can be concerning for the child's health. So below 6, just supportive care, home remedies with lukewarm water. I suggest keeping a anti-vomiting medicine also handy, because some kids can have their they can cough and then vomit out. So have antiemetic. ORS handy, so that's important, so that you can hydrate. And always, like, don't push your child when they are sick. Just go small amounts, sips of food, sips of ORS, so that they don't vomit their food. So those are some of the first aid medications I usually say. Saline drops can be kept handy. If your child is allergic with spring season around, have anti-allergy medicines handy. If your child has asthma, have asthma medication stock ready at home. A question being asked is, what about the routine vaccinations of our children? So I feel because of this very high peak, it's okay to delay your child's vaccination for 2 weeks to 4 weeks or 6 weeks, depending on how it's gonna be with this COVID second peak. But of course, you need to check with your pediatrician how they feel about it. All hospitals have very segregated areas for their sick patients coming in and their non-sick patients. So we also have just at the entry point, we segregate our healthy children from children coming with fever, so that there's no mixing and transmission of infection between the two. So check with your pediatrician. if the wave is as high as what we are seeing, it's okay to delay with couple of weeks, I would say. Coming to diet and activity, lot of talk about multivitamins, zinc. Really, guys, if your child is eating regular, healthy, local produce, please do not force them any other too much of multivitamins, because we are seeing these side effects of these multivitamins as well, where they can impact the liver. You can have kidney stones with very high vitamin C. So please be very vigilant of what you are giving to your child. Don't go overboard with you or yourself, with your child. Just eat healthy, local, fresh produce. Home remedies like haldi, yes, it has anti-inflammatory, so if your child is tolerant, you can try these home remedies, but again, don't go overboard with these activities. I think a lot of people were doing steam inhalation. We had some burn cases coming in younger children because they were giving steam every day to these young children, and they have no concept of steam, and it just pulls down. They would pull down and the whole thing will flip on them. So steam inhalation only if you can ensure your child can understand what's happening. Otherwise, please don't do it. Long-term issues, question that has been asked. So we're definitely seeing the social development part of the thing being affected in children, because they're not going out, going to school, interacting as much they should be. So I request all the parents, as much as they can, go for video talking with their family members, or decide like very small, one or two friends with same age group children, if you can have a healthy, safe interaction, and you and your husband or other family members dedicating them a good opportunity of interaction. That's highly recommended. How is it going to impact them physically? That time will tell, but we can with kids who have had COVID, pneumonia, and had might see some scarring, but hopefully in most of the kids, they're healthy and they recover pretty well. So from that standpoint, we are okay. Then role of vaccination, right? So from 1st May, we are opening it for all the people above 18 years of age, the COVID vaccination. There are vaccine trials going on in children as young as even 6 months old. So we should have a good data by end of this year, and probably even rolling out vaccination for children by early next year. So that should help us, getting our children protected and our community protected. Coming to the big question, when is this pandemic gonna get over? So just, from epidemiological standpoint, pandemics do not disappear just like that. They'll go in waves, okay? For US, it's the 4th wave. You must have heard similar waves happening in UK and other countries. The main thing is, your next wave should be better than your previous wave, which did not happen for India. So we just blasted in our 2nd wave, and a lot of reason we kind of talked about the multiple reasons for that, but that's we just need to work on it now. Let's make sure we don't have such high peaks when we see our next peak waves, what we are saying, before it disappears. I feel once we have very good vaccination coverage, we should see much improvement with this pandemic. So probably end of this year, we all should be vaccinated, if not the children, and will have which will contribute to herd immunity, and we should see better waves and peaks. And then question about safe outdoor activities, which I've heard a lot. I would suggest, like, right now with such a high peak, I would suggest as much as we can stay home, but you can choose a time when there's not crowding in your safe zone in the community. Choose that time. Make sure your child is following all COVID appropriate behavior, wearing a mask, covering nose and mouth. And then you can go cycling with your child or go for a walk. But again, please be very sure there's no mixing between kids where they are, because this is a very, very serious time going on, and we really need to curb this. So that's pretty much what I wanted to cover today. And then I'll start taking questions now. So I see Miss Sindhu Rajesh has asked, hi, doctor, my daughter is 2 years, 10 months. She has febrile seizure. What are the things I need to keep in mind in case she's affected by COVID? Also, the first step that I need to take immediately if she shows any symptoms. So if there is history of febrile seizure, what we usually suggest patients, parents to keep handy is a Mirasip nose spray. So that's basically, if the seizure is lasting for more than 2 to 5 minutes, that's the spray we use to hold down the seizure. So ask your pediatrician to prescribe that. Second is, febrile seizure happens because of high grade fevers. So let's try to control the fever well. So you should have all the appropriate fever medicines. It should be appropriately dosed per their weight, right? So cross check, because once their children are growing, we have to adjust the dosing per their weight. So make sure you try to bring down the fever. The one thing I've seen in patients is families is because the child is shivering because of the fever, they are just wrapping the child with multiple coverings. So that's not a great way to approach fever care, because that will increase the temperature more. So what we usually suggest is try to just have one covering or even no covering for the child. Better towel, big towel, and just spread it over the child, or even giving them bath with a regular temperature. So temperature water. So do that. Fever control. If they're actively seizing, put them on lateral position. Do not swipe their mouth. Okay, the reason we put them on lateral position is so that they do not choke. Don't put anything in the mouth. Swipe your finger, nothing. If it's lasting long, go for the Mirasip, which is a anti-seizure medicine. Ask your pediatrician about it, and then get them to the hospital. That's pretty much what we should do. Shruti Toro has asked, my daughter has been sneezing 5-6 times a day for the last 10 days, but otherwise she's fit and fine. Is it the cause of concern? Should we refer her to the doctor? So Shruti, we are seeing a lot of allergic rhinitis. So that's basically your nose. There's an irritation. So rhinitis is, rhino means nose, itis means swelling. So allergic is due to allergies. So with the pollination happening, spring happening, we are seeing a lot of these allergies going up in some of the metropolitan cities. So in those cases, we usually suggest, based on the age, some nasal steroids and some anti-allergy medicines. So you can see definitely that if it is really impacting your child health. So what all can I give? Okay, so that's the next question. So let me just finish this. Ask your pediatrician about the nose allergy medicine, and that should help. If the child develops cough, or if they have fever with this runny nose, so that's when you definitely need to seek medical attention for viral infections that need to be taken care of. Next question is, what all can I give my 5 years child to keep her immunity strong? As I had mentioned before, the main thing is giving them fresh local produce. I'm sure there are a lot of market based immunoboosters I'm hearing about, milk powders. What I usually suggest is just go for homemade, healthy, local food, and that's all they need. And regular meals, not skipping meals, avoiding junk as much as you can. Of course, they're children, right? So they need to still enjoy the perks of being a child. So I usually suggest, like, cheating day once in 15 days where they can go for junk. Try to make as much as you can at home with healthy options. So that's pretty much what I would suggest for boosting their immunity. So no, not going crazy about a lot of multivitamins, immunity boosters. Just healthy, fresh, local produce is what they need to be handling. Some of the other questions I had received was about breastfeeding mothers. If they become positive, what do they need to do? So if the mother is positive and the child is negative, and you again are primary caregiver, one of the option you have is you can pump, and then the milk can be given to the child. The other option is wearing a good mask, so N95 mask with good seal, okay, so that there's no leakage anywhere. And then breastfeeding, so cleaning your breast with just soft cotton cloth dipped in water, and then feeding your child with the mask on, and then distancing the child once you're fed at least 6 feet distance, if you are the only primary caregiver. But definitely continue breastfeeding. That's something I would highly recommend, even if you're positive. That's because that's the best food you can provide to your child. Rohini Pant is asking, are there any permanent or long-term effects of COVID? Briefly touched on it. Definitely seeing psychosocial effects on children. In the last 1 year, I had a teenager coming in with habitual cough. So basically he would cough the whole day. We did a lot of investigations. We didn't find what is the cause, and eventually found out it was just a habit he developed to seek attention from the parents. And then we had very young children, as young as 2 to 5 years of age, who came with a lot of tantrum issues in the family, a lot of behavioral issues. So that's pretty much the most important side effect we're going to see, because this is not their normal environment they are being raised in. So provide as much social interaction or attention to your child. What I tell parents is everybody's working from home, so have a very segregated area where you can explain to your child why you're not entertaining the child during those hours, because once you're at home, they expect you to give attention to them. So please talk to them, tell them why from this time to this time you are there, you are doing your work. If it's a very young child where you can't explain, try to choose this work area where they can't see you, right? Or close the room and have some other family member take care of the child. In your break times, please spend some time with your child. There are a lot of board games and simple family activities you can give. So do with your child. So do that just as much. Have family video calls, joint video calls, video calls with their friends. Encourage your teenagers to also keep staying in touch with with the other friends. So please work on the mental aspect of this pandemic, what the mental concern of this pandemic. Next question is Mona Lisa Anand. Can we give any multivitamin syrup to my 5-year-old daughter in order to boost her immunity? Pretty much what I have answered before as well. As long as your child is eating healthy, should be okay. Just good healthy diet is what they need. Some of the pediatricians are prescribing vitamin D because, of course, they're not getting enough sun exposure, so that should be fine. But I want to make sure that everybody understands that any medicine should be in a child should be prescribed by the pediatrician. It should not be something you just go over the counter and procure and start using. We're still waiting for some questions. Okay, Naya is asking how to ensure we build a child's immunity and also identify early signs of COVID. Also, does the flu vaccine helps at all? So first question is immunity. So that I've addressed. Also, early signs of COVID. So if there's a strong exposure history, travel history, and your child develops fever or cough with fever, cough with runny nose, vomiting. So those are the signs. You should definitely go for COVID testing for your child. And then, does flu vaccine helps? So flu is again a virus, and we did see pandemics in the past. Fortunately, we don't see it anymore because we have vaccines available for it, and we have medicines available for it. So it is definitely recommended in a younger age group till 10 years of age, and anybody in this pandemic, I'm suggesting all the family members get it, especially immunocompromised people as well, because at least we'll be protected against one virus. So I would recommend flu vaccine highly. Usually every year the strain, based on which flu vaccine affected the community most, the new vaccine is developed. So, and usually it comes around August to September time. So get your child vaccinated. If they're below 9 years, your doctor will be giving 2 shots 1 month apart. And then after, or if they've had their first 2 shots below 9 years, then it will be just an yearly vaccine. Should we give any kind of medicines to our children to keep them safe from getting infected? No. So every medicine has its own side effects. So there was a rampant use of azithromycin, AZ, and augmentin during the first year of pandemic. And now we know by the studies, these medicines do not help with this viral infection, because it's a virus and these medicines are for bacterial infection. Whereas it then has its own side effect in the children. So they'll develop diarrhea, their normal gut healthy bacteria is replaced by bad resistant bacteria. So we see a lot of resistance in our community then. So please do not give any medicines to your child. Just, I think the one message which I strongly would recommend, and is the cheapest way to help with this COVID pandemic, is COVID appropriate behavior. So please teach your child how to use a mask. Some of them could be hesitant. So maybe their personal toy you can choose and make a small mask for the toy. Go for, and parents are the role models. So if you're wearing it, they will follow it. Below 2 years, I'm not recommending a mask, because they can really have issues and suffocation issues with the mask. Do not use the tying mask. Go for stretch bands, because it's easy to maneuver, and go for the appropriate size mask. And then teach them that habit of maintaining 3 to 6 feet if they are in a public space, which actually they should not be now during this second wave. And then, of course, hand hygiene. I see very young kids even understanding the use of sanitization. There was a lot of obsession about cleaning the surfaces in the first the last year, but with the latest study, we know this virus spreads through droplets and airborne. So basically it's the fomites. So the surfaces are not being that high part of spread. Probably just in like COVID hospitals, we are taking precautions in regards to surfaces as well. But for a general public, I think we should not now be still stay obsessed with cleaning surfaces, or parcels of fruits and vegetables, how we were doing last year. So just wearing a good mask, maintaining that 6 feet distance, and maintaining hand hygiene should be good enough. Deepak Kadam has asked, shall we use a cleanser for cleaning food items also? So just now I addressed that. Please don't do that. Please. The fruits and vegetables are very porous. So if you start using chemicals, all these chemicals will go in. Just wash them under running water, and that's all you need. So the surfaces part has come down in regards to spread. Ankita, what part of diet will you suggest for baby to boost immunity this summer? Healthy, fresh, local produce. I think that's have been the mantra for me. So that's what. The other behavior which I felt I have seen and could have contributed to the pandemic is uh, people who have got vaccinated. They feel they're invincible. They will not get a virus, but it's not true. So even after vaccination, you can still carry the virus and spread it. You can get it and spread it. You can still have mild infection. What the virus is doing wonderfully is ensuring that people are protected from severe infection and not needing hospitalization. So it's great to avoid severe serious infections, but you can still get mild infection and you can still spread. So even vaccinated people need to be very, very cautious, and still that's why we are encouraging wearing mask. A lot of questions regarding even like what kind of mask. I feel unless you are going into high risk or you have a COVID patient at home, simple triple layer mask, cloth mask should be okay. Dedicate one cloth mask for one day of the week and wash it every day, and just like every day have another mask reuse, and then you can start reusing in cycle. So Monday one mask, wash it. Tuesday other mask, wash it, and just dry it in sun and use it. If you have COVID patient at home where you are gonna help them taking care, at that point of time I would suggest wearing a good N95, or by any chance you're unfortunate you have a family member who is hospitalized and you need to visit, then in those cases wear N95s. How can we make sure they are close to nature in this tough time? So definitely very, very challenging. What I usually suggest parents is, if you have terraces, take them to the terrace. If you have private terrace, private balcony, um, go out with them, show them the much you can. Or you can, if you have a safe community, not too crowded, choose a time when there won't be many people outside, to take them for a walk. And then uh, if possible, if you have a big park, early mornings, not everybody wakes up, then you can take them for you and your child can play with a football or something. But again, the main message here right now is protecting them from getting infection and spreading infection. So if there's overcrowding, I would still suggest staying at home, at least for this till this second wave settles down. Shruti Toro is asking, is it safe to use hand sanitizer regularly? So again, cleaning like every 2 hours or every 1 hour is not recommended. Clean it if you've been exposed, right? So once, if you went for groceries or some reason you stepped out of the house, once you come back, wash your hands, okay? Or preferably wash your hands. Or if you are by any reasons you are visiting hospital or some other outside place, then ensure before eating, you're sanitizing your hand. If you have handle your mask, then sanitize your hand. So basically, if you've touched any questionable surface, you are recommended to sanitize your hand. But if you're at home, then you don't need to, right? That's your area, that's your house. So not getting obsessed again with sanitizing incessantly is what I would suggest. Let me see, while the questions are being asked, if I have something else to cover. I think some of the family members had asked me also that if someone has had one COVID vaccine, and then they get COVID, what to do? And when do we say we are protected against COVID once we get vaccinated? So you're protected against COVID once you're vaccinated after you finish 2 doses, 2 weeks after the second dose. And that too is the minimum time. Usually it takes 2 to 4 weeks for the antibodies, the protection to develop. So that's when we say you're protected. If you've had COVID and you're still due for your second dose, we usually suggest waiting anywhere from 2 to 4 weeks after your first symptom of the COVID, and then you can get your second dose. It is recommended to get vaccinated even after COVID infection, because we do not know how long the natural immunity lasts. And with these new variants coming in, we are not sure if this will also protect with new variants. And with some reassuring studies that are coming in, that Covaxin and Covishield both might be covering the double mutant, I think still COVID vaccination is highly suggested. Yeah. I think these were some of the things I wanted to cover. I'll see if there are any other question coming in, and then we'll wrap up. Perfect. So we're done with the questions. I wish everybody a safe time. I know just when we were thinking we are out of the pandemic, we saw this horrible second wave, and it is very disheartening because it's keeping us away from our family members. It is keeping us away from the celebrations we all as human beings have been meant to be doing. So just give it time. As I suggested, pandemic has its own waves. Let's hope this wave settles down and we don't see such horrible waves in coming months. Stay safe, follow COVID appropriate behavior, and if you have any questions regarding your child's health, please seek medical help through online consultations, and please take care of you